Well, let's move close to home. Here in America, the US Surgeon General has declared loneliness an epidemic. Dr. Vivek Murthy is the first Surgeon General to issue an advisory on it. In a report released on Tuesday, he compared the health risks of social isolation to smoking a dozen cigarettes a day. Dr. Murthy's office is proposing a national framework to, in his words, rebuild social connection and community in America. And here's why. At any moment, about 1 in 2 Americans is experiencing measurable levels of loneliness. In a recent study, Americans spent just 20 minutes a day with friends. That's down from 60 minutes nearly 2 decades ago. Less time with friends, more feeling of isolation. And young people are feeling the strain more than most. Those aged between 15 to 24 reported a 70% drop in time spent with friends during that same period. The personal impact of loneliness is something the Surgeon General unfortunately knows all too well. I spoke with him a short time ago. I want to first touch on your own personal understanding of the cost of loneliness. And unfortunately, this is something that you know all too well after your first stint as Surgeon General. Could you tell us about that?
Absolutely. This is a story that is still very close to my heart because it's an experience of loneliness I had after my first tenure as Surgeon General. When that job ended, and ended abruptly, I was without the community at work that I had spent so much time with. But I'd also made a critical mistake during my time as Surgeon General. I had neglected my family and my friends during that time, thinking that it was too hard to both focus on work and focus on family and friends. And I was really suffering the consequences of that, which were a profound sense of loneliness that followed me for weeks, which stretched into months. And it was my wife, Alice, who helped me understand what I was actually going through. She's the one who noticed that I was getting lonelier and lonelier. So I think about that experience a lot because there are many people who struggle with loneliness, who feel a real sense of shame about it. In America, 1 in 2 adults report measurable levels of loneliness. And we know that kids and young adults are struggling with very high levels of loneliness. But this is not something we should be ashamed of. It's something that we should confront, something that we should talk about, and something that we should address. And that's the reason why I issued a Surgeon General's advisory on loneliness and isolation.
And the emotional toll it can take is perhaps more intuitive, the fact that it can lead to a rise in feelings of anxiety and depression. But here are some of the other statistics that you laid out. You said it increases the risk of heart disease by 29%, according to studies. It increases the risk of dementia by 50% and stroke by 32%. Were you surprised when you learned the physical toll this can take on someone?
I was surprised because when I went through medical school, I didn't really learn about loneliness and isolation. We didn't really understand it at that time as a health issue. But what I've learned since then is that it absolutely is. In addition to raising the risk of depression, anxiety, and suicide, the increase in risk of physical illness like cardiovascular disease, dementia, and stroke is profound. It also may surprise people to learn that the increased risk of premature death that's associated with social connection is on par with the risk that we see from smoking daily and greater than the risk we see associated with obesity. So this is a profound public health challenge, and it's why we have to address it with the focus and the resources and the attention that we afford to public health issues like tobacco, diabetes, and obesity.
So when it comes to addressing it, you've actually launched a national framework now. I want to read out some of the key components of that framework that you're proposing. There's strengthening social infrastructure in local communities, enacting pro-connection public policies, mobilizing the health sector, reforming digital environments, deepening our knowledge of the issue, and cultivating a culture of connection. But what can we expect to see from the government when it comes to enacting all of this?
Well, there's certainly steps that government can take. We certainly want government, and this is local, state, federal government at all levels, to really think about investing more resources in research so that we can more clearly identify the drivers and solutions to loneliness. We also believe the government can have an important role in providing resources to support community organizations that for a long time have played a vital role in bringing us together and helping us learn about one another. But participation in those organizations has really declined over time. But in addition to government, it's important to note that there are steps that workplaces can take to foster greater connection among workers. And that's actually good for people and it's good for business. There's steps schools can take to help build
Right.
in social and emotional learning so that children know how to manage emotions and can build healthy relationships. And finally, there's steps we can take as individuals, simply spending 15 minutes a day with people we love, making sure that we're present when we're talking to other people and not distracted by our devices, and looking for ways to
Yes.
help one another, recognizing service is a powerful antidote to loneliness. These can all help.
Yes, but isn't there an issue here that access to quality resources isn't even across all demographics and